Studying identical twins, researchers were able to determine the heritability of different substances. It was found that hallucinogen addiction is the least heritable, while cocaine addiction is the most heritable. Agents such as caffeine and alcohol are on the higher end of this scale. While a genetic component of addiction has been identified, environmental factors still play a huge role in whether or not someone will develop an addiction. As with many other diseases, having a certain set of genes gives an individual a genetic predisposition. This means that an individual has an increased likelihood of developing the disease based on their genetic makeup. Scientists have determined that half the risk for addiction is genetic. However, having a predisposition does not mean that the disease will manifest in the individual with 100% certainty. These genes influence the way your brain develops and how your brain will respond to different environmental influences. Scientists have shown that the environment plays a particularly important role in the teenage years. When teens are first discovering drugs and alcohol, their consumption of these substances is more dependent on the availability of the substances, the pressure from their peers, and the supervision from their family. As teens mature and grow into adults, their environment begins to have less impact. Those with no genetic predisposition may become casual or social drinkers, while those with the genetic predisposition are more likely to become addicted. While these are the general trends, there are many other factors influencing addiction. Trauma and mental illness can also play huge roles, regardless of the genetic makeup of an individual. Addiction is a complex disease,